Hello everyone, welcome to sqadia.com. My name is Dr. Saima Mushtaq and our today's topic of ENT is tonsillectomy. This topic of tonsillectomy, we know now that ectomy is the removal, so the surgical procedure in which the tonsils are removed is known as tonsillectomy. So we will in the first section talk about the indications. What are the conditions in which we lead to or we perform the procedure known as tonsillectomy? The indications can be absolute indication and relative indications. Then we will discuss the tonsillectomy performed as a part of some other operations. What are some contraindications of tonsillectomy and what's the anesthesia and position used for tonsillectomy. So our first section will pretty much cover the indications, contraindications, what are some absolute contraindications, absolute indication, relative indications, contraindications, and the anesthesia used for tonsillectomy and position. Then in the second section, we will discuss the different procedures used for tonsillectomy, which are the dissection and snare method, and then also besides dissection and snare method, some other methods of tonsillectomy. So second section will cover the procedure of the tonsillectomy. Then in the third section, we will discuss very important topic, which is the post-tonsillectomy care. How should be the patient managed after the tonsillectomy? What are some immediate complications of tonsillectomy and what are some delayed complications of tonsillectomy? So this will pretty much cover all the aspects of the topic tonsillectomy. So why we do tonsillectomy, what are some indications, contraindications, then we will go over different procedures for tonsillectomy, which one is the most commonly used, which are some less commonly used techniques, and then the post-operative care and the management of the patient, and then also delayed and early complications. So keep watching sqadia.com to learn about the tonsillectomy.